Those are really remarkable stories that we should all reflect upon. This is a tough time, no doubt about it, but we have to not lose our sense of community and think about the good stories that are happening. People all over the city and state really stepping up in this tremendous time of need. Now, as we just heard from the governor, the COVID crisis is clearly unprecedented, and the impact is still growing. And the City of Chicago will continue to support and partner with this governor, his team, and this state in any way that we can. Right now in Chicago, the total number of confirmed cases of COVID-19 is doubling about every 3 to 4 days. Think about that for a moment. We are doing everything in our power to keep that from happening in terms of this escalating beyond our ability to manage it. But we will only succeed if everyone acts responsibly and abides by the governor's stay-at-home order. As I have said, and is true, staying home saves lives. As I mentioned last week, if we don't, in the city of Chicago alone, we're looking at upwards of 40,000 hospitalizations. Not cases, hospitalizations. Here in Chicago, our capacity for cases is still well ahead of demand for now. But it's truly a race against time, and we have nothing to waste. And we are constantly working with various leaders and stakeholders from government, along with countless businesses, community groups, faith organizations, and others. In addition to the updates just announced by Governor Pritzker in regards to PPE equipment, the Chicago Department of Public Health also has delivered 600,000 masks and 600,000 gloves to Chicago hospitals, in addition to similar types of equipment that we've delivered to first responders all across the city. The City of Chicago is also proud to be partnering with the governor, FEMA, MPEA, and the U.S. Army Corps of Engineers to develop surge capacity in McCormick Place that will be needed in the coming weeks, given the trajectory we are seeing. And we are actively working on staffing solutions for this site as well. Just like our recent partnerships with local hotels, this new space will relieve the burden on hospitals and help ensure every individual receives the care that they need. And putting this together, we look to the leadership of other cities for best practices. I want to personally thank the leadership in Seattle, Washington, as well as King County, Washington, San Francisco, Los Angeles, New York, and other cities and areas of the city for their continued advice and guidance. The use of McCormick Place signals a new phase in our citywide response to the COVID-19 crisis, as we expect to experience a peak in cases in the coming weeks. This surge capacity fits within the plan that we have described over the past few weeks, which includes quarantine and isolation space, beds for vulnerable populations, and providing supplies to healthcare workers. We will have other announcements later this week to add even more support for our important frontline workers, our first responders and healthcare workers. We have to lessen the stress on our healthcare system, and first responders is a key priority in this fight. We are working with Governor Pritzker and his team to implement a seamless system between government actors and healthcare providers to create capacity in response to the needs of this rapidly expanding number of infections. These actions are being undertaken in conjunction with our continued efforts to drive increased assistance for food and childcare, create financial supports for individuals and small businesses, and much more. In that same spirit, we will again call upon all Chicagoans from all walks of life to explore volunteer and employment opportunities during this crisis. Your city needs you. If you have healthcare training, we have a job for you. Doctors, nurses, certified medical assistants, and healthcare administrators. These personnel are critical to manage the surge of patients we anticipate. We are also looking for others who can help deliver food assistance, childcare, and much more. For those interested in stepping up, please visit chicago.gov/coronavirus and look to the resources page, because there's plenty of opportunities for you to step up in this time of need. But as I've said time and again, none of this will have the impact we need unless our residents stay home. And I must say, hats off to the vast majority of Chicagoans who got the message and are staying home to to save lives. Each of our individual actions has a direct consequence on the lives of others like never before in our lifetime. That is why when it comes to this crisis, we each have a role to play, and staying home is a critical component of our healthcare strategy. Along with each and every one of our incredible healthcare workers in the Department of Public Health who have been doing the Lord's work to keep our residents healthy, as well as our first responders in the police department, the fire department, and OEMC, and city employees such as our CTA workers, sanitation workers, and custodial workers. And I'd be remiss if I also didn't stress the people at CPS who are working hard every single day to provide food for our CPS children and their families. We've been able to stay ahead of this crisis because of all of you, and we are deeply grateful for your incredible commitment during this time of sacrifice. We have to keep up those efforts. And it's my pleasure now to welcome Illinois' Director of Public Health, Dr. Ngozi Ezike, to the podium to share a few words. Doctor?